Hi, my name is Dr. Matt. How are you doing today? Wonderful. Thank you so much for coming in. Before we go in today's video, I would like to invite you to subscribe to the channel and to like this video so we can reach more people like you who need lots of tingles and relaxation. Without further ado, let's go ahead in today's video. Next patient, please. Hi. Nice to meet you. My name is Dr. Matt. Okay, we have a 4 o'clock appointment. And can I please have your first and last name? Okay. And your date of birth? Any new allergies that I should be aware about? Okay. Any medical history that we don't have on file already? Okay. I see here that you are in for an ear exam and also ear cleaning. Okay. Well, before we go ahead and make sure that you do indeed need an ear exam, I'm going to ask you a few questions so I can treat you better. Okay, so are you experiencing any hearing loss? Okay. And is that in both ears or just one? Left and right. Okay. What about ear pain? Okay. And is it on the outside or behind the ear? Have you noticed any abnormal discharge? Okay. Have you noticed any lumps on your ear or behind or inside? Okay. And have you inserted any foreign objects inside the ear canal? Not that you know of. Okay, I see here. So let's go ahead and begin. On a scale of 0 to 10, are you experiencing any pain? Okay, and how would you rate your pain on a scale of 0 to 10, 10 being the worst, and 0 means no pain? I see. Okay. Let's go ahead and take your temperature. Okay, so your temperature is 98.5, which is perfectly normal. What I'm going to do first is I'm going to inspect and then I'm going to very slowly palpate your ears. Okay, just stay still for me. Okay. Okay. What about here? The other side. So I'm noticing that both ears are symmetric and they're positioned correctly. I'm not noticing any lumps, no redness, no scratches. Everything seems to be normal. Okay, what I'm going to do now is I'm going to palpate. So please tell me if you experience any kind of pain. Now I'm going to palpate behind the ear. So that's the mastoid process. Any pain when I do that? No. Okay. Let's go ahead and switch. Any pain when I'm touching your ear? No, good. And what about here behind the ear? The mastoid process. Any pain there? Okay, good. Well, that's wonderful news. So let's go ahead and take a look inside the ear canal now. This is called an otoscope. It has a magnifying glass over here. It allows me to visualize the ear canal better. And right here we have a light. So can you please look right here? And try not to move, as I don't want to disturb any kind of balance that you have in here. Okay, so I'm noticing the ear canal has some abnormal discharge, but I think it's just earwax, just an excessive amount. And I'm not really able to visualize the eardrum because of the excess earwax. Let's go ahead and check your other ear now. Okay. So the same thing is happening over here. A lot of earwax that is a little bit unusual. And I can't see the eardrum. Okay. We're going to do a test. I just want to make sure that your hearing is not damaged. Okay, so please tell me when the vibration noise stops. Stopped. Okay, we're going to do that on the other side. Okay, and it stopped. Okay. In order to clean your ears a little bit better, I'm going to insert a few drops in your ear. So just stay still for me, please. Good. And I'm going to insert a drop in your opposite ear now. Okay, wonderful. I'm going to let it sit while we prepare all the instruments needed. I'm going to take a look inside your ears one more time. I want to make sure that I can see the tympanic membrane and make sure that we took all the earwax out. Okay, so it seems like the tympanic membrane is pearl gray. Margins are very well defined. Okay, so tympanic membrane is vibrating normally. I'm not noticing any signs of edema or infection. Okay, let's go ahead and check your other side. Okay, so same thing here. Tympanic membrane is pearl gray. Margins are very well defined. I'm not noticing any kinds of extra fluids or purulence. Everything looks very normal. No signs of infection. Okay, wonderful. So I'm just going to explain a little bit what we did, and I'll write down my notes so we know exactly what we're looking for next time when we'll have another ear cleaning. Okay. So there was no redness and no swelling. Also, you're not complaining of any tenderness. Okay, no lesions, no drainage, and no foreign bodies that I was able to notice. Tympanic membrane was pearl gray in both ears, with very well defined landmarks. Okay. Both ears are positioned centrally and in proportion with the head. And they're about 6 centimeters tall. Good. No edema, no inflammation, no redness. You weren't complaining of any pain, so that's good. If you enjoy this video, please don't forget to subscribe to the channel and to like the video. Also, if you have any comments that you would like to share with me, just let me know in the comments below.